All right. Well, welcome to the Kurist podcast. Today, we're going to be diving into the world of pediatric gastroenterology, specifically focusing around Crohn's disease and ulcerative colitis. So today, we're actually joined by Dr. Abu-Salih, who is a very experienced pediatric gastroenterologist on the Kurist platform, who helps these patients navigate those complex cases. So, Dr. Abu-Salih, thank you so much for joining us
Thank you.
today.
Thanks for having me.
Yes, of course. Well, I would love to start off if you could just tell us a little bit about yourself. We'd love to hear how you got to where you are and what you love doing.
My name is Majdi Abu-Salih. I'm a pediatric gastroenterologist, board certified in that specialty and also in general pediatrics in the U.S. I'm based in Indianapolis, Indiana. I've been in pediatric gastroenterology for the last 13 years, and I enjoy my work a lot. I like to help children. That's the main reason I went into pediatrics to start with, and realized early on that pediatric gastroenterology is a specialist that is in high demand, and that there are so many gastrointestinal diseases out there that I can help with.
Yeah, that's good. All right. So, Dr. Abu-Salih, focusing on specifically different inflammatory bowel diseases, those can be extremely difficult to navigate for these patients. So, how might someone with IBD seek a second opinion, and how does Kurist meet that need?
So I think Kurist provides an amazing platform. I lived part of my life in the Middle East, and I know that in terms of medical care, although they have fairly advanced healthcare there, there's always a need for second opinion and seeking expertise in all specialties and fields. We all know that United States leads the world in innovation, and the pharmaceutical industry has originated in the U.S., and we provide a lot of innovative options and treatments that are not available to many countries around the world. And we know that the physicians that are trained in the United States are the top, the top tier of specialists worldwide, and they're the ones leading the research in all medical specialties. So to be able to connect with someone who's U.S. based, who's board certified, who has that knowledge without having to travel to the U.S. is an amazing advantage that a lot of people, I'm sure, would be interested in and would like to seek help with. I know that on many occasions, there were times that we would have loved to have the opportunity to speak to a specialist in the United States, and the only option, 20, 30 years ago was to actually travel to the U.S. and seek medical care and second opinion, which is a very expensive thing to do for anyone who lives in the Middle East. So Kurist is providing that tool, that venue, that channel where these patients can now, the click of a mouse, a phone call, that can seek expert opinion for a very decent, reasonable price, I think, for the response that they're going to get and the expert opinion they're going to get from those physicians.
Yeah, no, that's great. And it sounds like, these patients are having that opportunity to either get that second opinion advice and confirm what they were feeling or what their doctors told them, or even, if their gut is telling them, hey, I got this diagnosis, but I feel like it's incorrect.
Right.
Getting that US board certified stamp on there, I think, is super cool. So
Absolutely.
That's great. Great
Absolutely.
to hear. Yeah.
And especially IBD, or inflammatory bowel disease, is I wouldn't say a fairly common condition, but it's not extremely rare. Estimates go as far as about 10 in 100,000. Most of them are Crohn's disease, and this is now increasing in incidence worldwide for a multitude of reasons. But the condition is a chronic inflammatory disorder that affects growth and development. So these kids, some of them are undernourished. They have a lot of active gastrointestinal symptoms. The disease has many complications, and the treatment can be really difficult. So to navigate through the options of treatment is something that people will be looking forward to having by contacting someone on the Kurist side to help them get through that. We also have to remember that most of the new innovations in treatment and medications are being produced in the US. All the research that has been done on the different types of medications that are used has been done in the US. So to be able to have someone in this country where all this innovation is happening and to be able to give them the most up-to-date data on what treatment choices they have is an amazing thing. And like I said, they don't have to travel anymore. They don't have to come here and pay out of pocket for medical care, which we know is very expensive in the United
Absolutely.
States. So this provides them with a very reasonable option.
Yeah, no, that's great. Thank you for sharing that. And I know you touched on Crohn's disease and a little bit more into IBD. So, what do you believe would be a main reason why a patient who's experiencing IBD or even Crohn's disease might want to seek that second opinion medical advice through a Curist?
I think that in terms of diagnosis, we do have the most advanced and up to date equipment and techniques and testing done. There are many things that need to happen before a diagnosis is made and confirmed. And some of these things are not available overseas.
Mhm.
So it's not applicable to the Middle East medical care because they don't have them. And so there are blood tests, even simple blood tests or stool tests that can be very helpful in reaching a diagnosis that are not available or very expensive. We're able to help them navigate through that and prioritize to them what things need to be done and how to arrive at a final diagnosis. And then once you have that, then you're stuck with, okay, how do we treat it now? There are many medications that are available at their disposal, but they're not they're not really accessible over there because they're either not covered by the insurance or very expensive or they're just not available in that country. And so we can give them alternatives. We can discuss with them what their options are. We can talk about, what would be the safest thing for them. What are the adverse reactions? What are the side effects? And they can then decide what they want to do. So again, these are chronic conditions. These patients live for 40, 50 years with this disease because sometimes this disease is diagnosed at the age of 5 or 6 years of age. And they're going to live with this condition that cannot be reversed or taken away. It's like diabetes. It's a chronic condition. We know how to treat it, but we can't get rid of it.
Absolutely.
So, this is a long-term, lifelong diagnosis that they have to deal with. So they
Absolutely.
need to get on the right track from the start. They need to get the best care early on so they can have a good outcome in regards to their diagnosis. And Curist can provide that because we are very familiar with these diagnoses. We're familiar with how to offer the treatments. We are familiar with all the tests that are available to make such a diagnosis. For us, it's not difficult. But for these patients, it's extremely difficult, again, because of all the limitations that they have in their region of the world where they live, whether it's they don't have the blood test, they don't have the stool test, they don't have the radiology, or they don't have an endoscopist who can make a diagnosis. So all these complications and issues can be avoided if you have someone who can give you that expert opinion and guide you through it, hold your hand and tell you the best option for you would be in those
Absolutely.
situations.
Yeah. And with those diseases, especially, you're dealing with children, they
Yes.
might not know what they're dealing with. And, they go to see a doctor from the country that they live in and they could be misdiagnosed, mistreated, and that can definitely be very scary. So thank you for sharing
Mhm.
that. Um, Again, you are dealing with children with pediatrics. And so my question to you would be, how does Curist help to incorporate those family members and help them with the education that they need to work through treatment plans for IBD or Crohn's disease?
So pediatrics is a very unique field. So, this is the specialty where you need to talk to the parents. So
Hmm.
you need to make a good connection with the parents. They're advocating for their children's health and well-being. And now you've just handed them this diagnosis. It's not cancer, but it is potentially cancerous if it's not treated. So you're handing them this diagnosis of a chronic disease that their young child is now going to have for the rest of his or her life. So that's not easy to deal with. So we have to hold their hand, kind of guide them through and show them that no, it is treatable. And we can give you excellent outcomes for this condition. Again, as I said earlier, we can't take it away. We can't reverse it. We can't remove it from their bodies, but we can definitely manage it so they can, live a healthy, long life with this diagnosis, with this disease, with safe treatment options. There are many medications that can be used. Some of them have a lot of harmful side effects, and we can tell them what's the best and safest for them and, provide them with the information they need to have to guide them through this. So, this is not easy to hand a parent this diagnosis for their child. So we have to collaborate with the parents or work with them because they're the ones advocating for this minor child. And this condition continues on until they're now adults. And now we have to deal with the patient who was a child or a minor and now is an adult who has to make decisions for himself or herself, which changes the narrative on this. But it's the same condition that adults have. The medications are the same, basically. And as I said earlier, these are all available here in the US, and we have the expertise and the knowledge in detail about these treatment options, adverse reactions, side effects. So we can help them through that.
Absolutely.
And then they can make the decision which one they want to go with.
Yeah, no, that's great. And I think Kurist does a really great job of providing that second opinion medical standpoint from our physicians to the patients or the family members who might be seeking that extra confirmation from
Absolutely.
our physicians here. So I think that's really great to point out that, it is a lifelong commitment. They might start out as children, but, they could be dealing with it 30, 40, 50 years down the road. So yeah, definitely getting the important care for that is important. Kind of speaking on IBD specifically, it can definitely be a sensitive topic for most people. So I'm sure privacy is a huge concern. Could you please touch on a little bit how you believe Kurist does a great job handling that aspect of it?
When this company was started, that was a huge deal. We have a lot of emphasis on the confidentiality of patients, their diagnosis, their treatment, their history, and so that was really privacy was a fundamental, central point in when this company was started, and so that was one reason I agreed to join them because I felt very comfortable. I felt that they're really taking care of this. It's run by physicians, and in the US, with HIPAA regulations, privacy is extremely important. And so, having that in mind, this company was established with privacy and confidentiality as a very important aspect of healthcare and providing consultation to these patients and their families. So I feel very confident. They have a lot of, you can say, like gatekeepers that watch closely to make sure that this remains confidential and the privacy is very, very important. They also have, information technology and cybersecurity experts on their, payroll that are employed by Kurist to make sure that this absolutely happens on a regular daily basis. As I said, I lived for a number of years in the Middle East, and I did my medical school overseas. And I know that that's something that's not really very strict over there. So people can rest assured that this is really something that will be taken care of because this is also what we practice day to day.
Absolutely.
In my own practice, we put a lot of emphasis, and our healthcare systems and hospitals always focus on this. And there are penalties, and there are a lot of negative feedback if you don't really pay attention to this particular issue. So absolutely, this was, like I said, one of the fundamental main reasons that I agreed to join. And I know that early on, when we're in the early stages of planning this company and forming it, that this was one of the most important things that all physicians brought up is how can we guarantee privacy, confidentiality with regards to medical records, information, history, and treatment options, and, to safeguard this and protect the identity of our patients.
Yeah, absolutely. And I know Kurist, when it was first founded, it's not just a check mark of, protecting that privacy and that patient privacy or the data on the website that's used. It's built in every level of the platform. So it's very, very important. So thank you for sharing that. All right, doctor, we're going to finish off with
Okay.
one last final question. How do you see platforms like Curist with the online second opinion expertise shaping the future of IBD?
I think that, as I said earlier, for worldwide, overseas, Middle East countries, this is going to be of huge importance, and I think it's just going to continue to grow. We talk about modern technology, information technology, cybersecurity, AI, all these things that are now, developing very rapidly, and we're
Mhm.
trying to keep up with these things and catch up with all these changes that are happening so fast in the world. Um, this is something that will be very, very attractive to people in the Middle East.
Mhm.
We know that healthcare is very expensive. We know that if you want to come and get an opinion in the US, it's expensive to stay here, to travel here, to seek healthcare here.
Absolutely.
It's even expensive for people that live in the country that have health insurances.
Mhm.
So coming in and be a someone who's paying cash for everything, it is extremely difficult and very, very expensive.
Yeah.
And so we're providing them with a tool that's reasonably priced that will give them all these answers and hold their hand and help them navigate through their diagnosis and give them the best treatment options. And then put the ball in their court basically, because now they can decide which one to go with and which one to choose to take care of.
Absolutely.
So I think it's going to just continue to grow as we see now with the information technology and all these changes and accessibility and all these things. I think it's going to just keep increasing.
Yeah, no, that's great. Well, Dr. Vasali, thank you so much for
Yeah,
joining
thank
us
you.
today. It was great to hear all
Thank you.
about, IBD and Crohn's disease and how you believe that Curis is doing a good job, connecting those dots for those patients overseas. And to all of our listeners out there, we just want to reinforce how Curis is really doing everything we can to bridge that gap of second opinion medical advice from our US based physicians. So
Thank you.
thank you
Thanks
again.
for having me.
Thank you so
Appreciate it.
much.